Hey, good evening. This is Ben Braffman, director of the Academy, and I'm here tonight to talk to you about ethically growing and marketing your private practice or your facility in the right way. What I've done is I've set it up in this way because that is such a vast topic. How to ethically grow something, ethically grow a company. Um, uh, we're going to talk about it in the context of good treatment and a guide to good treatment. And I'm going to get into all of the pitfalls that come along with ethically growing your private practice and your facility. So let me start off. I did a PowerPoint for everyone. This is actually one of my favorite topics because it's so chock full of information that's useful that you can use every single day. And so um, the there's a lot of subject matter, so I will get through it as quickly as I can. I'm anticipating that there'll be some, some questions for it. But first off, let me start off with some of the headliners. The guide to good treatment, and this, of course, it segues into the ethical practices of private practice and facility. So it starts with assessment, admissions, and what's called a treatment match. Finding effective help for all substance abuse issues. It starts with getting a reliable screening from someone who cares and who can direct the person or family to the right help. Once substance abuse is detected, more in-depth comprehensive measurements are needed to assess history-related disorders, family issues, and psychiatric issues. These assessments explore interrelated factors that help assist in placing a client and identifying their level of motivation. Not paying attention to any of these assessment instruments, from the initial call to the psychosocial, then to the integrated diagnostic summary, can alter a patient's chances at recovery. So right away, we're actually talking about ethical practices. One of the things that goes on in rehab is that rehab is not federally regulated. It's not even state regulated in a lot of ways, not really. And all the things that I just touched upon: assessment, criteria for admission, treatment match, which is so critical. They're not regulated in the way that they need to be. What's rehab on the left side of the street is not rehab on the right side of the street. And so when you are growing your practice, or when you're looking for treatment, if you're somebody looking for treatment, make sure that the front end, the assessment, the admissions, are your needs going to get met, or is it just sort of these blanket statements where we'll meet your needs, we'll work with you, we'll take care of you. These are not sayings and cliches that you want to cling to. As a consumer and as a professional, you want to know exactly what that means. And as a professional, you want to be able to identify what you mean by that. And so it speaks to what is your private practice and facility stand for? What is its mantra? What is its message? Well, who are you actually treating? And which I will circle back to and get that. So comprehensive treatment. We know our patients, generally speaking, suffer from co-occurring disorders and other issues that are sometimes never spoken about or even handled within a patient's life. Depression, anxiety, schizophrenia all need to be addressed. Medical issues such as liver disease, Hep C, diabetes, and high blood pressure need attention and require patients the appropriate care. So again, does your practice, does your facility, can they medically assist all of these diseases? Do they have a doctor that literally can help you with your diabetes and your obesity? What about your Hep C? Do they have the medication? Do they have what it takes to deal with a schizophrenic. Many times, unfortunately, rehabs will accept you because they want to bang your insurance card like it's a credit card. And they're really not interested in whether or not they can actually treat your depression or your anxiety. They just want to make money on a day in and day out basis. And it's really a black eye on the industry. But not all hope is lost. Let me just say that. Emphasis on phases of treatment. Continuing care is essential to your recovery. That is a absolute foundation, and of course is interwoven with the ethical practices. Without it, patients are essentially wasting their time. They're coming in for treatment. Well, how long are they going to stay? What level of care? What are they going to get by each level of care? Unethical practices will bring patients into treatment, doesn't matter what their condition is, and they will exploit those patients by doing some of the following things. They will actually pay the patient to get other patients to either stay in treatment or find patients that are in other treatment centers and get them to come in. Patients will get their families, facilities will get patients' families involved in getting other people to that treatment center. They will sign up for insurances and make the facility the main address of where all the checks and notices should go to. These are just some of the some of the practices that that go on. But within treatment centers and private practices, further unethical behaviors occur. You are billed for things that you shouldn't be billed for. You are billed for labs that you don't need. A few years ago, there was a gold rush in urine, and people were getting $1,500 a day. I'm sorry, a lab specimen. So something's wrong with that picture. Having strong relationships between a treatment center and a healthcare providers, peer support groups, halfway houses, or recovery residences produce a way better outcome. You got to be connected and got to have a very strong network. A guide to good treatment has to do with dignity, respect, and the environment. The facility needs to treat everyone with dignity and respect. They are people and should not be looked at as just a number. A good way to approach this is to say everyone eats, regardless of your socioeconomic status, meaning your basic needs need to be met. You are a human being. You deserve it. It's not prison. Respect is a two-way street. Each patient should be treated like a family member. The environment should be clean and organized, as well as cheerful and positive for all patients and families. Typically, in a treatment center that is unethical, run poorly, men and women are sleeping together, literally sleeping together, hanging out together all day long. Group therapy consists of who passed the note to who and who brought drugs in, and how they can get drugs, cheeking their medications, sharing their medications, being resistant to treatment, wanting to get thrown out. All of that does not constitute a very cheerful environment for treatment. Keep in mind that coming into treatment just might be the worst day of somebody's life. So if you're not empathetic to that, which to me is a form of unethical practices, and you can't relate to the patient, or quite honestly, you don't care, you don't care about the patient, then you need to be out of the business. It's as simple as that. Family and loved ones need to be involved. This is a big one. And I'll get through this slide, and then I'll share with you some of my thoughts about some of the unethical practices. Engaging with family in treatment is essential to success. By engaging with families, patients tend to stay longer recover longer, and have an overall more positive experience. Many times the patient is just the representative of the family unit. Family members are sometimes the cause of the drama and the sickness in the family. Clarifying family roles, behaviors, and skill building should be part of the treatment process. Families should know the rules, expectations, and the patient's treatment plan as a preview of what is coming. Families should be involved on a daily and weekly basis. In addition, families should have their own time to vent and process all the insanity that goes on. This typically happens with a family program that spends days, weeks, or months with the families. So good treatment follows those ethical practices, that they include the families, they share with the families, they talk to the families more than just the financial phone call where they say, okay, you owe us for another month of treatment. They explain the methods that the treatment center uses to take care of their loved ones. They provide structure and support. They give guidance to the family members on what to do when they're home and how to do it. Unethical practices are keeping patients too long in treatment because they know that you have family. Many times treatment centers will actually look up family members and their jobs and how much money they make, and base their decision on keeping a patient based on how much money a family makes, which is despicable. Where in that is the best care for a patient who's literally dying from a disease that wants to kill them? It's nowhere. Evidence-based practice, this is a big one. This speaks directly to ethical and unethical practices. This has to be simple, straightforward, and widely accepted. For example, cognitive behavioral therapeutic techniques, family systems, and the language of family systems, motivational interviewing have to be part of the treatment modality. 12-step, of course, which we'll get to. They all work because they have been tested and are consistent. Yelling at a patient to shame them and prove your point is not therapy, it's actually abuse. Talking to a client until they agree with you is not therapy. It's unprofessional and will only cause problems and browbeating. 12-step for substance abuse users needs to be incorporated, as this has been proven to work for millions around the world. Staff should know all about the 12 steps and their usefulness. No, not all staff needs to be in recovery, but let's review some of the evidence-based practices. Number one, cognitive behavioral therapy is extremely effective with the substance abuse and mental health population. Why? It is widely researched, it is very consistent, and it speaks directly to the pathology of an addict and somebody who has a mental illness. It challenges irrational beliefs. It challenges somebody's feelings. It questions your beliefs on things that might be causing you a lot of emotional pain. Cognitive behavioral therapy should be at the forefront of every single rehab in the United States, plain and simple. Why? Because it works. If a treatment center does not have cognitive behavioral therapy techniques, they really shouldn't call themselves a rehab. Approaching more evidence-based practices, you have to have a family system and the language that goes along with that. Everybody that comes into treatment comes from a family of origin. So your clinical staff and your support staff need to be educated in cognitive behavioral therapy and family therapy. They need to understand and empathize and have compassion for the roles of the family. They play a major role in recovery. If a treatment center does not have cognitive behavioral therapy and family systems in their modalities, I will question their practices, their ethical practices, and whether or not they should even call themselves a rehab. Motivational interviewing, which used to be known as solution focused, is basically dealing with highly resistant patients. It's actually a fantastic way to confront a patient. I'm not saying that in a negative way, but carefrontation and identifying a patient's resistance is crucial to the acceptance of treatment for somebody. And so when you're doing motivational interviewing, you're focused on three components. One is the level of motivation, the level of commitment, and the level of optimism within a patient. And if you can chisel down to those three areas, you've really got something special. Unethical treatment centers and practices don't care about any of that. They shame you into believing that they're right, you're wrong, and basically that you're a scumbag, and that's why you use drugs, and that's why you're depressed. And if you don't do it our way, it's the highway. Later in the slide here, I talk about the 12 steps. I am a believer in 12-step work, especially as it's complemented with cognitive behavioral therapy, family systems, and motivational interviewing. The 12 steps is not recovery. It's not recovery in the sense of it's not rehab, but it is the 12 steps, and there's structure to it. Millions of people are sober today because of the 12 steps and because of the themes and principles behind the 12 steps. A couple of those themes, like acceptance and honesty, and giving back to to the next person, are all part of the therapy that should occur in a practice that's ethically based. I question treatment centers that have little to no knowledge of the 12 steps, and many of them do. And the reason that they do that they don't adhere to the 12 steps is that they'll make something up, and they'll say, hey, listen, we can cure your addiction. We can cure this. You can't cure something that doesn't have a cure yet. You can arrest it and you could slow it down, but you can't cure it. And the 12 steps, the way I look at it very simply, it's like medication. Take your meds, go to group, do the next right thing. Okay, so further down the line, with a guide to good treatment, and of course, this all links to the ethical practices, strategies in retaining patients. So the entire staff needs to be involved in keeping a patient in treatment. You never know who has touched or motivated a patient. I'll give you guys an example. I ran Destination Hope, a treatment center in Fort Lauderdale, for 15 years. It was one of my missions, sometimes successful, sometimes not, that the entire staff was on the same page when it came to helping a patient understand the benefit of staying in treatment. Not forcing them to stay in treatment, but understanding the benefit. So that means that you have to cut off the supply of the oxygen of the disease of addiction. So you have to get the families involved, maybe a sponsor involved, maybe an outside therapist involved, maybe the group itself involved, and they all have to be and the staff all have to be on the same page and really send the same message to the patient. It's tremendous leverage and tremendous impact on a person who's being told by people that he trusts or she trusts and his peers to stay in treatment because of XYZ. I've done it. This is what happened. As opposed to one person saying it that may or may not have the best interest of the patient. Patients should have a trusting relationship with their therapist. Patients should make at least one friend in their treatment group. Therapists and staff should be ensuring that the family is supportive of the treatment center. Therapists should be aware of the weakest link within the family unit. There should be transparency within treatment plans and goals with patients and families. Positive rewards and fun should be taking place in treatment. Treatment shouldn't be all depressive and the end of the world. And while I'm at it, when you're dealing with a place that is unethical and doing things that are really not on the level, they don't care about these things. For example, I can boil down a patient's treatment experience to two or three things. Number one, they need to have a trusting relationship with their therapist, plain and simple. If they don't have a trusting relationship with their therapist, they're going to leave treatment. Number two, they have to make one friend in treatment, just one. Somebody who they identify with, not somebody who they're going to get high with, but somebody who they're working with, and hopefully it is gender specific, which I may get into a little bit later on. Number three, the family of the client, the patient, needs to be on board. They may not like everything you have to say, but they need to be on board. And that is just critical to the success of a patient's treatment while they're in a particular treatment center. Excuse me, I'm sorry about that. Those three things. Unethical treatment centers, they exploit the weakest link in a family unit instead of encourage. They ask grandma for money. And a lot of times there's a lot of secrets in families, and treatment centers that are unethical, that use the dark arts of therapy, will call grandma and get $10,000 from her, and she won't even say anything. Family members will send drugs through the mail to patients and not say anything. They'll buy plane tickets. And once that happens, the therapeutic relationship is over and the patient needs to leave treatment. It's as simple as that. Moving right along, a guide to good treatment. You need qualified staff, you need ongoing training, and you need supervision. The staff should be well diversified culturally and educationally. Just because someone is a recovering addict or went to treatment does not automatically make them a qualified professional. I said that before and I'll say it again. That the two are not synonymous. The staff should have ongoing training in two ways. Number one, training that meets the expectations of state and national standards. And number two, training that is unique to the treatment center. So for example, whatever state you're in, so in the state of Florida, the Department of Children and Family. Department of Children and Family has minimum requirements throughout the year that an individual or treatment center has to adhere to. Big deal. Those are just, domestic violence, HIV training, CPR, and then dive a little bit deeper, maybe some case management stuff or some clinical stuff, standard stuff that you should get. But then there's stuff unique to the treatment center, like what's our success rate? What's our culture? What do we do? Am I qualified to be here? What's our belief in abstinence? How do we treat families? Those are also the trainings that need to occur so that families understand the methodology of the treatment center. And then everybody should be well versed in 12 steps. Listen, I'm old school. I'm not saying that 12 steps is for everybody, but you should be well versed in the language of the 12 steps. That is an absolute. In quality treatment centers, there is actual supervision of the staff on a daily, weekly, monthly basis. There's actually staff meetings with the entire staff so that the leaders can get feedback and know what to change. Not everything is perfect. Not everything changes. There should be weekly or daily, weekly group meetings with the clients. Get their feedback. What do they want to do for fun? Remember, these are human beings first. These are not cattle, and they're not just number signs. And unfortunately, they are treated too much like numbers, and it's actually sickening. It actually makes me physically sick to talk about some of the unethical practices that goes on. Another popular unethical practice is there are rehabs right now, and as we speak, there is unqualified, quote unquote, professionals, unqualified, sitting in a group right now giving advice to a patient. That is ludicrous. Somebody with no degree, no high school diploma or a high school diploma or a bachelor's level degree, dealing with a schizophrenic, a bipolar disorder, a multiple relapser, has no business telling a patient of that quality what to do and how to do it. Absolutely not. That entire treatment center should be under review. People need to have standards and a standard of care. A 22-year-old individual who happens to be in recovery and works in a treatment center is not qualified to tell a patient what to do and how to do it therapeutically. It's complex. There's a lot to it, and they're going to mess it up. And that doesn't even, I didn't even mention the family component of it. You just want to keep that completely separate and have the professionals deal with it. All qualified personnel that are therapists in a treatment center should have a master's degree in counseling or related field. They should be licensed. You should have a mix of certified addiction professionals, master's level counselors, PhDs, psychiatrists, MDs, nurses, RNs, all of that stuff. Absolutely, absolutely the truth. The one caveat that I will say that could occur in a substance abuse treatment center is the following. I did this and it was very successful and I support it, but it has to be the right thing. And here's the following. A lot of times treatment centers will have that guy, that treatment guy that everybody loves. He's got a following. He's probably streetwise, old school junkie. You can't pull the wool over his shoulders, over his head. I'm sorry. Just all the cliches that you can think of. And his groups are dynamic. They're energetic. They're powerful. The patients leave there. They're pumped up. Staff that are in there, they're just blown away. Yes, they are okay. But here's two things. Number one, what they're sharing with the patients has to be very specific to their personal experiences and some of the stories that they have to make a point. That's number one. And they need to be under supervision. And when they document, it needs to be signed off by a licensed individual. And I would even take it a step further and say that licensed individual should be sitting in that group with them. Besides, they'll learn from each other. So there has to be personalized approaches, gender specific, age specific, mental health specific, should all have their own groups and needs met in a timely manner. Remember, women and men and mentally ill all have different needs that will need to be addressed in different ways. Here's the deal. Most of the time that doesn't happen. Men and women are mixed together. A selling point of an unethical treatment center is men and women can not only, they are in groups together, but they're hanging out at the pool together. The women are wearing bikinis, the men are wearing Speedos. Forgive me for saying that. They are all vulnerable. It's inevitable that they're going to have sexual relations. It's inevitable that they're going to get high together. Gender specific treatment works. The data is there. Smaller intimate groups work. Age specific groups work. I'm not so sure that age specific groups work as effectively as gender specific, but they do work. And I'll give you a couple examples. So if you have younger, let's just use men, for example. If you have younger men versus older men, and let's define young, old, at 35. And my apologies to anybody who's 35 and older or 34. I don't mean to tell you that you're older, whatever. 35 and older have different consequences than the 20-something-year-old knuckleheads that are in treatment. A 50-year-old man who has his own business, whose wife is threatening to leave him, whose kids hate him because he's high all the time, has different consequences than a 20-year-old who basically his problem is that he didn't have $10,000 in his bank account this month. He only had $5,000, so he could only use $5,000 worth of drugs. Those are completely different consequences, and those are completely different circumstances. Now, to that point, in treatment, when you're dealing with massive egos and you're dealing with narcissism and antisocial traits, it's a great idea to take some of those 18-year-olds and put them in the 50-year-old group, and vice versa. Peer-to-peer confrontation under the right circumstances is very, very powerful. Being told by a peer that you're doing X, Y, Z, good or bad, is going to be very, very effective. So that works. And then the mental health component, they need their own groups. Somebody who is severely depressed or anxious or schizophrenic, they need to know that that is being focused in on and honed in on. They need probably a little bit more individual attention. You certainly can mix the two for dual diagnosis education, but they definitely need their own time. I would even split that up a step further and have psychiatric disorder splits in group, where schizophrenics are together, and then you have your depressed and your anxieties together. Personality disorders, they sort of run the gamut between being mentally ill and drug addicted. Typically in substance use disorders, personality disorders or traits that you're going to associate with that are antisocial personality disorder, narcissism, narcissistic personality disorder, and codependent personality disorder. And in the, so they are going to be somewhat of a mix. And that's where I go back to assessment. I go back to having ethical practices about what you can and cannot, deal with. Measure of performing performance. This is incredibly important and speaks to ethical practices because people are going to ask you the question about success, which I'm going to get to. An indicator of quality is keeping score of your performance and tracking it monthly, yearly, etc. Most important is doing the necessary follow-up that it deserves and identifying whether your performance is going up or down and why. Making necessary changes as the treatment center grows. Also, tracking information that is interesting and valuable to your treatment center. So let me give you a couple of examples. An unethical place will make up numbers. Yeah, I made them up. We're at 100% success rate if you follow every suggestion that we give you. So because we're the best, of course you're going to follow us 100%, which is just absolutely ridiculous. Your AMA rate against medical advice, that needs to be tracked. Let me tell you why. Let's say your AMA rate in your organization is 10% per month. Let's just say whatever the number is, 10%. I will bet your bottom dollar that of the 10%, 90 to 100% of your AMAs occur in the first 7 days. So what that tells me right out of the gate is that something is going on in those first 7 days, maybe even before they come to treatment, that you can fix clinically or operationally. Now, this speaks to unethical practices. Why? Because a lot of times marketers or treatment center owners or clinicians will lie to a patient to get them into treatment. Do you have a golf course? Yeah, of course we do. Do you have horses? Yes. Do you have maid service? Yeah, of course. Yeah, come on in. And of course, they have none of that. The golf course is a broken down miniature golf course. The other services are just non-existent. They were lied to. They want to leave. If you were lied to, you'd want to leave too. So tracking true statistics is critical. And guess what? No treatment center should be afraid, hesitant to send stats to families. Now, how should you track success? If you're unethical, you make it up. You say manipulative things like, well, how can you really track success? And the person would have been successful, but they didn't follow more suggestions, or they didn't do this, they didn't do that. That's all a bunch of bullshit. The way that you track success, there are certain standards. Number one, did somebody come in, say they were going to stay 30 days and stay 30 days? The answer is yes. Okay, track that. That's successful. Great. Did somebody come in and say they're going to stay 30 days, but they stayed actually 60 days? Is that successful? Yes. What happened? Why did they stay an extra 30 days? What did you do? What did you say? What's their level of motivation? What's their level of commitment? What's their optimism with this? Then another key component to success is the family. You can never forget the family. Now, many times people that come into treatment are going to relapse. Relapse is a big part of this whole thing. And different rehabs do relapse differently. They have different standards. Again, what rehab to the left does versus rehab to the right, it's two different things. Many people will say, well, relapse is part of it, and we'll bring them back. No questions asked. Okay, I understand that on some level, but let's be real. The reason that treatment centers bring back patients is because they had decent insurance, and they're going to bang their insurance more. And if they have a higher level of care, now they're going to get paid more. They don't really care about the family and the patient. That's what goes on. Now, that also being said, is that a patient could come back under the right circumstances, but it depends. If a patient got into a fist fight with a staff member or another patient, not so sure they should come back. If they sexually acted out, and I'm talking about sexual assault, not sure that they should come back. If they've been to treatment at your treatment center 15 times, maybe it's time to move on and transfer that person out. I can go on and on and on, but unethical treatment centers will bring back a patient no matter what, and they will make the clinical staff do whatever they have to do to keep that patient so they can get the insurance money for one more day. To me, that is over the top. It's greedy, and it's actually speaks volumes to the lack of education, the lack of coping skills, and the lack of professionalism that a treatment center has. So you got to be mindful of all of that. Does a treatment center have external accreditation? Do they have DCF? Do they have Joint Commission accreditation? Hopefully the answer is yes. You should do your research on that. Have there been any complaints? Now, let me just make a comment about external accreditation and complaints. Are patients going to complain? Yes. Can you make everybody happy? No. But maybe there's a theme going on within that organization. For example, I was lied to, and there is no trauma track here at XYZ Treatment Center. And let's say that complaint is 5 or 6 times documented. That speaks to a bigger problem. And as a consumer, you should be wary of that. And that does classify as unethical practices. The other thing in terms of unethical practices is, how does a treatment center get their patients? If they get them through social media, what exactly are the mechanisms in which they get them from? Do they use a call center? Who is that call center? What's the relationship with the call center? Are they getting kickbacks from the call center because they're sending them patients? What's their relationship with their lab? What's their relationship with anybody? The bottom line is patient brokering goes on in rehabs way too often, and it's totally out of control. Patient brokering and unethical practices has no business in this industry, and it's absolutely sickening. Patient brokering means people literally will drive around, look for people that they think maybe need insurance, sign them up for insurance, bring them into treatment, pay them for treatment to get other patients to come in, get families to drive to other treatment centers to bring them in, to bring them into that treatment center. The other thing that they do is they use patients as social media conduits. Patients write blogs, patient writes reviews to increase their Google space. This is all unethical practices that has no business here. The problem is it's not regulated. The problem is that many of the consultants that work at treatment centers are more unethical than the treatment center owners themselves and the people that participate in it. This occurs every day. People are exploited every day, and they use they use the attraction of seduction to get people into treatment. In fact, there are rehabs right now that allow people to get high while they're in treatment. Suboxone is one of them. Medical marijuana is another one. They simply don't care. The disease of addiction does care, and the disease of addiction is killing our population. It's an epidemic of unbelievable proportions that is not going anywhere. And we need good practice. We need people out there that can go through this and that can understand and ask the right questions. You've got to ask the right questions to get to the bottom of what is actually happening in a treatment center. I will say this: if you're interested in engaging in the treatment industry, I think it's a wonderful thing. There is nothing like helping somebody and seeing them at their worst, and they come back after 3, 6, 9 months, a year, and they thank you. It's a wonderful thing to actually see, and we need good people. So that's all I have today. I hope that there's some questions. I will stay here for for some Q&A. Please let me know if there's any questions that anybody might have.